done attacking Medicare and the federal budget. But the next stage of this attack has just started.
What we have from the Abbott government is a fundamental attack on one of the great Labor legacies, and that is Medicare, universal health care for all, something that defines who we are as a nation.
A $7 co-payment is the first step towards saying that we are shifting the cost of healthcare away from being a community-provided public service to being a private good and a commodity.
Good healthcare is equal access, it's preventative health, it's early intervention. It is not delaying health until illness and disease sets in. The nurses and midwives who work across New South Wales, they understand that a copay will delay people's access to health.
The government's own figures show that 500,000 extra people every year will turn up in our emergency departments, putting more pressure on the staff and more pressure on a system that is already struggling with $3 billion worth of cuts from the Liberals in New South Wales.
This co-payment is designed as a disincentive. What it will do is make people hesitate before they seek health care.
Any society can only be tested on how decent it is, on how it treats its most vulnerable. And you can have no more vulnerable people in your society than those who are sick and injured.
There will be families who have to choose between taking a sick child to the doctor or putting food on the table.
This is bad for health, it's bad for people, and it's bad policy, and we won't stand for it.
The privatisation of the Northern Beaches Hospital, and it can be called nothing but privatisation, is the next step. And the destruction of the pharmaceutical benefits scheme by the Trans-Pacific Trade Agreement is the next step, and there are so many steps. We have to defeat this right now. Here and in the Northern Beaches and across New South Wales, we have to say no to the Americanisation and no to the privatisation of our healthcare system.
Medicare is the people's health system. It is not the government's to dismantle and sell off. We say hands off and no way to the copay.
Abbott, come off it! Healthcare! Abbott, come off it! Healthcare!